Breast augmentation is the most common elective surgery among women in the United States. Our second guest is Dr. Ivan Turpin, a plastic surgeon and the former chief of the Department of Surgery at St. Joseph Hospital in Orange. In February 2007, silicone implants were once again approved by the Federal Drug Administration, and there are new and improved implants that are awaiting approval. Welcome, Dr. Turpin.
Ivan, thanks for coming. How many breast implants are done each year about?
It's a very popular procedure because of the high patient satisfaction. It's over 300,000, I would say, in the United States per year.
And you're involved in some of the training programs for the residents locally here?
Yes, I'm a professor of plastic surgery at the University of California, Irvine, and I'm responsible for teaching the residents cosmetic surgery and breast-related type of reconstructive issues.
Do you anticipate surgery becoming more and more common over the years as the population ages?
Oh, absolutely. It's people, as long as they have their health and want to look good and feel good about themselves and have a positive, self-image.
It's going to be there. They're going to be busy. And,
yeah,
I mean, I've known you for over 2.5 decades. You've been the busiest plastic surgeon I've known. What about the silicone breast controversy, that implant controversy? That's history now. What happened with that?
Well, as you may recall, back in 1992, the FDA was overseeing breast implants and medical devices, and there was some reports suggesting that there may be some autoimmune problems associated with silicone implants, like lupus and some of these diseases you've heard about, rheumatoid arthritis. And so when the FDA looked into these implants and they looked at all the data, they felt that there wasn't enough safety information, not enough studies being done, and had been done rather, and so they wanted a moratorium on the use of the implants. The commissioner decided to have a moratorium, and the press gets a hold of this, and next thing you know, it's off the market. And we were without silicone breast implants for 12 to 15 years. The cancer patients could still have them, but not the cosmetic patients. So we were using saline implants, and they have their drawbacks, and there's pros and cons and trade-offs with all these implants.
So saline implants were used for cosmetic purposes during that moratorium, but cancer patients could still use the silicone implants.
That's correct.
And so if they'd been really, really harmful, one does have to assume that the silicone implants wouldn't be used on reconstructive surgery for cancer patients.
That's what many of my patients wondered. How come it was okay for them but not their daughter?
Not their daughter, sure.
To have it, and it didn't make sense, and there's a lot of politics involved, and with the regulatory commissions that oversee these things. And
well, I noticed that you brought some implants. Do you have a silicone implant there and a saline one? Can we see a demonstration of?
I brought a few implants to educate your viewers a little bit about what's available out there now. We have two basic types of implant that's available on the market. We have a saline implant, as you see here. This is a silicone elastomer, a rubber material with a valve on the top, and they come empty like this. This is an empty silicone implant, or saline implant, pardon me. And you take the valve off, open it rather, and plug into this valve right here, and then you fill up with saline on the operating table. These came out on the market about 1965, right after silicone was first used as an implant, about 1962. So this is the one type of implant. This is what was available during the moratorium. Then silicone is the same type of elastomer that holds the silicone in, but it has a filler in there that's pre-filled with a silicone. This is not silicone like you see on the periodic table in your chemistry class. This is a complicated polymer, and the longer the polymer, the firmer it gets. If you go to your hardware store, you'll find silicone on the shelf. It's an excellent lubricant, and that's why it was invented initially. It was an excellent lubricant for our submarines during World War II. They could run more silently, and you didn't hear all the noise. But if you make the polymer longer, then it gets stiffer and firmer, like we're seeing here.
So these come in different stiffness or consistencies?
Well, historically, they thought they were too hard at first, and then they made them a little softer because they felt more natural. and then they started to leak, and we had all the problems during the 80s with the first, second generation implant. Then in the 90s, there was a moratorium, and they started making it a little firmer with less oil in it, so you wouldn't see it get into the lymph nodes and migrate beyond the implant should they leak. And then right now there's some on the market, they're trying to get the studies done so that the FDA will approve them for a stiffer one, and that's just one I've got to show you right here. It's this one's a cohesive gel, which means that there's no oil in it. And
it's still silicone, but
it's silicone, but it's stickier. They can make silicone so hard it's as hard as this table.
Oh.
I see.
And sometimes I carve them. You know, when you make chin implants, you can carve them. They're firmer.
Oh, really?
And so the chemists can have this whole gamut of silicone they can make, and so by increasing the cross-linking between the silicone molecules, it gets firmer.
So, for instance, for cheek implants or chin implants, you use silicone for that
You can.
as well?
That's one type that's available.
Huh. So it's not just for breasts?
No, absolutely not.
It looks like it has a rough surface to it rather than what's that for?
This is a texturized implant or textured implant, and this one is smooth. You can see the difference here. These came out in the late 80s. Try to cut down capsular contracture. That's the scar that forms around the implant. And it would tighten up and make the breast look unnatural and firm. And in animal studies, it seemed to work pretty well. The drawback is to make them textured, they had to be a little stiffer. And they had a lot of problems with these folds showing, and the patient satisfaction rate, at least in my practice and around here, was not as high. Most of the people were using smooth. But as we were talking about a minute ago, these new ones, they're stiffer and they're teardrop shape. I don't know if the cameraman can appreciate that, but keep them. If you're going to be teardrop, they have to be textured so it'll stay upright.
Yeah.
See, and also this is like Jello. It's pretty stiff, and it stands up. So that's what they call form stable. These are the next generation. Maybe they'll be out next year. Depends on what the FDA feels about the studies being done.
This day and age, then, how many opt for saline versus silicone?
It's a personal preference of the patient. When you present both you talk to the patients about it. There's I find about 50% go one way and 50% the other. The advantage of silicone over saline is that it doesn't ripple as much. You don't have the folds visible in the skin, especially my cancer patients that are very thin. Their breast has been removed, and they can show a little rippling sometimes, especially immediately, and that rippling is a real negative, and silicone doesn't do that. But saline, on the other hand, if you've got a lot of breast tissue over it, the advantage of saline is that when it leaks, you know it. It goes down. You don't have to do an MRI, which is the only way to detect a leak in a silicone implant. It's the most reliable, not the only way. Mammograms will pick it up. So we have about 50-50 in my practice, because some will want this one just for safety and not to be worrying about it because of some of the other issues related to the silicone.
So that brings up another point. You can still use mammograms to detect breast cancer with either of these, right?
Absolutely. Yeah. The FDA talked to the Radiology Society. I think it's the American Radiology Association, if I recall. And that was a big issue. Very first thing in the 90s. Does this interfere with the detection of cancer? And the radiologist said no. We do some extra views. There's no evidence in the literature that it was a problem, and there's been studies to see if people with breast implants show up with more advanced cancers than people without breast implants, and they've never been able to show that, and so they watch all this, and that's pretty much been laid to rest. It's not an issue anymore.
And Dr. Turpin, how long can one expect to have one of these implants last in the body?
You got to realize a lot of these implants are new now that are on the market, so we don't have a lot of long-term data, but it's I think it's reasonable nowadays to expect them at least 15 years. The older implants fail a little sooner, There was a high failure rate after about 10 years. That's why initially people were saying, well, maybe we should change them at 10 years. It's hard to determine when they leak and fail. But nowadays, the newer ones, and I think they're going to last a lot longer.
Well, thank you very much for coming today and filling us in on the latest in breast implants.